Well, hello everybody. I'm Gregor Gimi from 27 Pilots. I'm here with Luisa, who is a CEO and co-founder of Komed Health out of Switzerland. If you were
Yeah, thank you. Thank you so much for inviting us over. So as you mentioned, I'm Luisa Dober. I'm the CEO and founder of Komed Health. Komed Health is a young company based in Switzerland, in Zurich. And what we do is helping doctors, nurses, and other healthcare professionals communicate better, communicate more simple, safer, and faster. Our vision is to help them save lives ultimately by providing them a secure messaging platform that can be connected to the systems already existing in a healthcare institution. Although we are in 2020, doctors and nurses still use fax, pagers, DECT phone, even WhatsApp, which is unsecure, to exchange patient information. And our goal is to eliminate it gradually by providing one single platform connecting all their communication.
Okay. Can you how is this current coronavirus crisis impacting the demand for your product or the need and the urgency to adopt your product in the healthcare sector?
Yeah, so I believe that our value proposition is more relevant during these times, and we've seen adoption of overnight of healthcare organization of digital solutions that can help them do their work better and faster. Mm-hmm. And at the end of the day, accurate, actionable, secure, and real-time communication during such a crisis, during a pandemic, can save lives. Mm-hmm. It's all about communication, and especially when people are working remotely. And they still have to take care of the patients, the corona patients, but also the patients who are still in the hospital without the corona, but who mm-hmm. still need to be taken care of. We enable them to communicate securely on-site, but also off-site, and have the information they need at their fingertips.
Okay. Could you give us a brief demo of your product?
Sure, let me just set it up. Okay, so basically I'm logged in on our desktop version of our application. So our platform is available on iOS, Android, but also desktop, as I mentioned. It actually works as a standalone device, but also integrates, as I mentioned, with different systems in the hospital, like Active Directory, supporting single sign-on, scheduling system, patient information, lab results, radiology reports, and so on. So the application is structured in 4 different parts. One is groups, one is direct communication, same as WhatsApp, one is patient cases, and one is role-based messaging. So basically, with Komed Health, all the in-hospital instant medical team communication is centralized in form of different chats, as I mentioned. I am logged in as Jenny Meyer. Our application is available in 4 different languages at the moment: German, Italian, French, and English. And I started my shift. I'm a nurse in chemio. And here I can see all the group chats I'm part of. It could be groups that are already Active Directory managed by the hospital, or groups I can create easily myself around specific topics and invite my colleagues. It can be direct messages. But the biggest value of Komed Health is, in the moment I start my shift, I can see all the patient cases I'm currently treating. So in the moment a patient arrives to the hospital, we automatically create a chat room with the name, date of birth, and so on of this specific patient, and we invite the treating physician and the nurses on the shift. And this is done through our integration into their systems. So I started my shift. I see here all the patients I'm currently treating. If, for example, I'm missing a patient and I want to check, I can basically just search a patient based on the name, ID, room, or so on. So let's take a patient, Emma Ebel. So I can see that Emma Ebel, she is age 33. She had a post-car accident. And here I can see all the people involved in the patient care. What we have realized through our research, and we have done thousands of hours of research before we started, before we implemented our application in different hospitals. One of the big problems is doctors and nurses don't have an easy overview on who is involved in the patient care. Mm-hmm. So here with our application, you can easily see who else has been involved when and who is currently involved in the care of the patient. As well, when you need to share information to a large number of people, I would say larger than 2 or larger than 3, instead of calling each one of them and disturbing in their different work, here you can send a notification or a message to everyone involved in this specific patient. Also, supposedly you need to add a radiologist, you can add the radiologist by the name or by the function in this specific chat. So the participants are added as much as possibly dynamic, but also based on the shift changes, but also can be added manually. So if you look in the patient chat, you can see a number of features, very simple messaging features like taking pictures, taking videos, adding participant, adding documents. But also we have, what we have realized also through our research, doctors and nurses on the go, they just want to know proactively when the information that they have requested is available. How they do it today, a physician is calling the radiologist, is the report ready, what is the preliminary result? With our application, proactively, we send a notification when the result is ready. So then the doctor can ask the radiologist what is the preliminary result. Currently, he normally calls. Most of the time, nobody answers. He goes physically to the radiologist, interrupting. And this is very time consuming. Yeah, it's very time consuming and can actually affect the patient care. So through our application, in the end, it's much more than a messaging platform. In the end, becomes an operational platform that makes collaboration between healthcare workers around the patient more efficient, enabling them to know and get notifications whenever important information about the patient is available. And this can be sent directly to their mobile phone or on a desktop.
Wonderful. In the sake of time, could you also comment on adopting your solution at this point by one of your clients? First question would be, how safe is that? I mean, you're a small company. How reliable are you in terms of rolling that out?
So in terms of security, it's one of our pillars. It's very important for us, so that's why we offer our solution in the cloud. Currently, we are working with a Swiss cloud provider, so the data is in Switzerland or for EU in Germany, but can also be on the premise of the hospital.
Okay, but in terms of, let's say, financial stability,
I think we are in a good position financially at the moment in terms of our current reserves. So we have raised so far 2 million. Also, we are backed up by investors who are coming from healthcare.
And how fast can you deploy your solution? Let's say a hospital or a hospital management company comes along and says, "Hey, I need that." How fast would they be able to operate with your solution?
So the standalone application is available in few hours. If we would do integration with Active Directory, supporting single sign-on and Active Directory managed groups, this would be ready in 48 to 72 hours, even earlier. But I want to take the conservative approach. And when they want integration with patient information system, this is case by case depending on the system, the legacy system they are using. So for this, we would need to understand better the infrastructure.
Okay, great. So to this point, thanks a lot for all this information.